We're actually going to start today with an incredible set of leaders that we're just so fortunate to have here. Our outgoing president and chief executive officer of Marshfield Clinic Health System, and currently our chair emeritus, Dr. Susan Turney, who is currently leaving as chair after 3 wonderful years as our chair of the board of directors. And I'm so thrilled that we've got Amy McDonough as our new chair this year for the board of directors from Fitbit Health Solutions from Google. So we'll have her later as well. And I'm excited that we've got such incredible females leaders in our organization. And it's just a great, I think you'll be really, really impressed to hear the work that's going on, both of them within their organizations and their thoughts and visions about eHealth initiative. So we've got a brief day today. Tomorrow we'll meet again starting at 12, and we have an incredible panel tomorrow looking at health equity in the COVID-19 vaccine distribution, with a wonderful panel with Verily Life Sciences, Arcadia, and LexisNexis, as well as the National Academy of Medicine tomorrow, talking about COVID-19 vaccine distribution, which I know everybody's interested in. So that should be a really fantastic session, moderated by our own Juane Dixon from eHealth Initiative. And then tomorrow afternoon as well, we've got really a bang up, incredible group. Dr. Saraba Batninger, who is the Chief Medical Officer and Head of Technology and Performance at United Healthcare. Adam Pellegrini, Senior VP at CVS Health. And Roy Schoenberg, Dr. Schoenberg, who is the President and CEO of Amwell, talking about virtual care delivery during COVID-19 and beyond. This is just a really stellar group of folks. And if you want to understand what's happening now and what's going to be happening in the next 18 months, I guarantee you're going to want to tune in for that session. It's going to be really incredible. And then day 3, Thursday, 12 noon again, we've got a great interview with Senator Catherine Cortez Masto from Nevada, who's going to be talking to us all about privacy, COVID release, all kinds of things, healthcare as well. She's done a lot of work with new privacy bills, and she's also on the Senate Finance Committee and doing a lot of work in terms of financing COVID relief for healthcare organizations and technology. So that's a great interview as well. And then a wonderful panel with Alice Leiter, our own Alice Leiter from eHI, talking about protecting healthish data. And as you know, we just rounded out our Robert Wood Johnson Foundation grant. We'll be releasing that framework in a couple of weeks here. And Alice is going to be talking to a couple of very influential folks, Jody Daniel, who's a partner at Crowell and Maureen, Laura Hoffman from American Medical Association, and Liz Salmi, who is with Beth Israel Deaconess Medical Center, a really powerhouse group as well. And then wrapping up the day, we will have our very own Catherine Pugh from our policy group here, who's going to be talking to Google Cloud, Duke University Health System, and Humana, all about digital health policy. Again, a really incredible, influential group of folks who are going to be sharing with us their perspectives and their views. So as you can see, we've got kind of a couple of short sessions over a period of 3 days. Hopefully you can log on for an hour or 2 during the day and hear what's going on. I think it's going to be a great window into the work that we're doing and how we want you to get engaged as we move through this year. So I do want to just share a couple of quick updates with folks. And again, thank all of you for all of your participation this year. We have a tremendous amount of groups engaged right now. This is just a sampling of some of the groups. It's hard to get everybody's name on a slide here. And I do want to really highlight for you the new faces this year. This is a copy of the different organizations which just joined us. So if you're not familiar with some of these groups, I really want to encourage you to reach out. They are all listed on our website, and we are, as you know, always happy to introduce folks to each other. So if there's an organization here that you want to get in touch with, we are always happy to play matchmaker and arrange meetings and introduce folks to each other. So please just reach out to myself or Amy or anybody on the staff, and that's what we'll do. And then I also want to share with you some exciting news about our 2021 Board of Directors. We have an incredible group of new directors who joined us this year from CVS Health, Amwell, LexisNexis, Humana, Who am I missing here? Athena Health, United Healthcare, and Accenture. So a great new group of leaders have joined us this year. And as I mentioned before, Amy McDonough is our new chair this year, and we'll be talking to her in just a moment. But really a wonderful group of leaders to help us navigate through the next year. And I think everybody's really familiar with the work that we do, the education, advocacy, and thought leadership. But I did want to share with you our critical issue areas, which haven't really changed much since last year. I think we're all still very focused on COVID-19 best practices and education. So you're going to continue to see a lot of work out of the organization focused on COVID. And we're going to be looking at virtual care. You know, last year we actually called this area telehealth, and we've shifted now to really think about this area in terms of virtual care, because there's all types of care being delivered virtually, both synchronously and asynchronously. So we're going to be exploring that more this year. And then we're continuing our work with the Robert Wood Johnson Foundation and looking at consumer privacy for health data, and doing a lot more work this year on SDOH and analytics. If you haven't met our content leads, these are our content leads. 1A Dixon, hopefully you've seen these faces before, and if not, you'll see them a lot over the next 2 days. Our Director of Program Strategy and Development, really an incredible background in SDOH, a wide breadth of experience working on social determinants of health, and we welcomed her to the team last year. Catherine Pugh, I think you've all are familiar with, has really done a significant amount of work in our policy area and promoting and advocating for reimbursement policies last summer in the CARES Act. So hopefully you've seen her name. And our very own Alice Leiter, our one and only privacy expert in-house, who's leading the work of the Robert Wood Johnson Foundation. I'm so proud of this team. I can't say enough good things about the folks that we have leading our efforts, and I hope that you will reach out to them as much as possible to get engaged. So how do you get engaged? These are a couple of ways, and I want to make sure everybody's familiar with the work groups, the executive briefings that are going on right now, and the networking. We will continue to have our monthly work group meeting for SDOH and data analytics, and 1A is leading that. I'm actually going to have Sarah, I know you're online right now. If you could send out through the chat box a link to the web page that has a list of all the upcoming meetings for the work groups, and we'll send that out to everybody right now. And what I encourage you to do is look at those work group meetings. There's a list of when the next meeting dates are, and identify somebody in your organization to attend those meetings. We're also going to be having a monthly policy briefing, which will be led by Catherine Pugh, and that monthly policy briefing will focus on really whatever's going on right now in terms of the Capitol Hill, or if there are key regulations or things being discussed. So that will change depending upon what the critical issues are for the month. And then a bi-monthly privacy briefing led by Alice Leiter as well. You'll continue to see that, and you saw that last year. And then our own policy steering committee, which really leads the work in terms of what types of policies or regulations eHI as an organization wants to support, endorse, or promote on Capitol Hill as well. So that group continues. So I would encourage you to get involved with one of those groups. And then something new that we're offering. We just started recently holding these 7-for-7 network sessions. So this is basically a cocktail networking hour where you are online with 7 people for 7 minutes each at 7 o'clock at night. It's almost like a speed dating for eHI participants. So you get into a Zoom room with 7 different folks and breakout rooms, and you move through rooms, and you get to meet a number of different people and network over an hour one evening. So we'll be sending out sign-up information for that, and I want to encourage all of you to do that. It's just really a great way to meet people. And I know because we're not able to have those cocktail sessions right now and in-person meetings, this is really a great substitute for having some one-on-one time with different folks in the coalition right now. So I want to encourage you to sign up for those. Courtney Watson from our staff is going to be organizing those. So please sign up for those sessions. It's a great way to connect with others in the network. And we're going to hear a little bit from Catherine on Thursday and from a number of folks who are working on our advocacy efforts with the Policy Steering Committee. But I really wanted to just highlight the incredible work that Catherine led last year. And I know I've talked about this on webinars and at Leadership Council meetings, but they have done a significant amount of work, that Policy Steering Committee, in terms of participating in sign-on letters, comment letters. Catherine and Alice met with dozens of folks really on Capitol Hill virtually, of course, not in person, but really advocating for your needs and what our organization is interested in promoting. A lot of work done around telehealth, virtual care, and reimbursement, and really figuring out how to make this work throughout this pandemic. So I just want to highlight their efforts. And I also want to just really highlight the folks that are a part of that steering committee. And this is a list of the individuals who participate on the Policy Steering Committee. This is a tough job because it takes a lot of time out of your week. They're usually meeting at least once a week, and when there's important legislation or regulations being reviewed, they spend a lot of extra time really pouring through that and trying to think about that. So I want to just commend this group for their continued efforts. And also Brad Walters, who's the new chair of that group this year with Marshfield Clinic Health System. And Brad has been a great value to helping lead this group throughout the year. So we're delighted that we have Brad. And of course, Catherine Pugh, again, who staffs that group and helps lead it as well. So if this is something that you're interested in, if you're a policy wonk, if you're really interested in kind of the nitty gritty of what's going on with regulations and legislation, please reach out to myself. We're always looking for additional folks who live and breathe policy and want to participate. Our goal is to have a broad, diverse group on here. Not all vendors, not all hospitals, but a little bit of everybody to help really represent the eHI multi-stakeholder groups. So please reach out to Catherine if this is something you'd like to be considered for in the future. And then I also want to just let folks know we were concerned about COVID at the beginning of 2020 and how that would impact the executive roundtables that we conducted in person and the extensive educational programs and conferences that we did in person. And I have to tell you, we had more events in 2020 than we've ever had before, but they were primarily all virtual. And our attendance and participation in those webinars and executive sessions has just really soared over the last year. This is just a sampling of some of the different programs that we have available. And I want to just encourage you, we are a nonprofit, so all of this material, these slides, the resources from these programs are available for the most part online. And you are welcome as, our key executives to go online, download, look at any of those slide presentations, reports, briefings, anything that comes out of those programs. And I want to really encourage you to continue to do that. And similarly, if we, our 4 focus areas coming up for 2021, if you have a case study, if you have an example, if you feel like you would be an appropriate person to really represent one of these new areas, I would love to highlight you or feature you on a webinar and promote the work that you're doing. So please reach out to myself or Amy or Catherine, Alice, 1A, any of us, if you feel like you could speak to one of these areas. We want to get you as involved as possible. And I do want to make sure I also share with you, we again cranked out a number of publications in 2020, more than we have in the past. A lot of work and reports and briefings around COVID-19. We did a lot of work looking at supporting American Indian and Alaska Native communities combating COVID-19, had several roundtables around that. Catherine led a really great effort looking at the CARES Act and how that impacts people, had a wonderful working group looking at that recommendations for COVID-19 moving forward. A lot of work around social determinants of health. So I encourage you again to take a look at some of that, those publications and download them. Those are for you. We do that work not for ourselves, but for the greater community. And then the other area of work that we've kicked off, and hopefully you were able to participate in our program last week, was looking at pharmaceutical groups and how they're working around SDOH. And we did a report looking at pharma and payer groups and how they're working together. So another area that if you're interested in, and that's something that an area that you're working in, please reach out to us. And then finally, I just want to thank the team. Because we're not all together, we couldn't do a group photo, so this will just have to do for now, but I think you're all familiar with our team. So we'll just have to work with emojis for right now, but we have a really incredible team right now. Sarah's on the line right now, so Sarah, say hi and send out, she's sending out as much information as possible. I just talked about Juane and Catherine and Alice. Courtney and Emma, I think a lot of you communicate with them via email or get the blasts, and I think everybody knows Amy as well. Lindsay is a new face from last year who's doing a lot of work with Juane and with Catherine on policy, so hopefully you'll get to meet Lindsay this year as well virtually. So again, I want to encourage you, we are a small group, but we really value our relationships, and you're the most important thing to us. So I want to encourage you to reach out to any or all of us at any point and let us know how we can help you.